As a nurse case manager, I will provide a case report on Mr. Jose. I took care of him several years ago while working at an acute care hospital. He has chronic type 2 diabetes, and due to current exacerbation of symptoms and related complications, he has been admitted. Mr. Jose is a Hispanic male in his late 60s, married, and has 5 children who live nearby. He is on Medicare and has a fixed income of Social Security. He speaks very little English and needs a Spanish interpreter. He worked as a laborer previous to his retirement due to his declining health. The primary nursing diagnosis that will be used for Mr. Jose will be ineffective health maintenance related to uncontrolled type 2 diabetes, as evidenced by elevated blood glucose, declining vision, wound on the foot, and kidney failure. Mr. Jose is admitted for complications related to the medical diagnosis of type 2 diabetes, including hyperglycemia related to uncontrolled diabetes and a foot ulcer of the left great toe due to peripheral angiopathy with gangrene and necrosis to the bone. He also has chronic kidney disease, he's anuric, and he receives dialysis 3 times a week. He was diagnosed about 10 years ago, but speculated that he had undiagnosed diabetes several years previous to his actual diagnosis. Self-care capacity for Mr. Jose is very limited in many areas. Self-care tasks are what Mr. Jose will need to perform at home to prevent complications and manage his disease. As his health has continued to decline, the ability for him to manage his own health or fully recover from the current exacerbation and complications will be challenging. Currently, there are many factors that are influencing the self-care, including age, race, gender roles, income, living conditions, and symptom severity. Mr. Jose has had repeated admissions and continues to have weak compliance due to motivational level, cultural factors, health literacy, and lack of education. After diagnosis, he didn't feel the effects of his diabetes and didn't have the needed follow-up resources and behavior changes to prevent these complications. Pharmacologic treatment is needed for various medical conditions. He's insulin dependent on a rapid-acting and long-acting insulin. Recently, his blood sugars have remained over 300 at home, and he needs a dose adjustment while in the hospital. He's on sliding scale at meals and before bed. Also, he's developed a wound on his left great toe. It's been unresponsive to treatment, and he's now going to require amputation on this visit. He was taking oral antibiotics at home, but it's currently been switched to IV, and he's receiving dialysis at the bedside 3 times a week. Gets Renvela with his meals. Non-pharmacological treatments that have been recommended previously include blood glucose monitoring, dietary modifications, and exercise. He is not overweight, but was slightly overweight prior to his declining health. He also has declining vision, and he's considered legally blind. The family assists him with his cares, dressing changes, feet inspections, and medication management. He's currently receiving outpatient dialysis 3 times a week, and his daughter drives him to his appointments. In the hospital, nurses are providing all wound care, medication management, and patient teaching needs to be a priority. Priority patient issues for discharge planning must include a safe discharge to the appropriate facility or home setting that best meets Mr. Jose's needs and goals. Understanding his Medicare benefits is necessary to facilitate transition to the next level of care available, covered, and other covered resources and necessary supplies such as durable medical equipment that also need to be covered under Medicare. His relationship with his family, friends, community, and healthcare team are important for improving his outcomes because of his limited self-care and self-management. Priorities in the day-to-day management of his diabetes include symptom disability monitoring, monitoring of physical indicators, managing complex medication regimens, and maintenance of proper levels of nutrition, diet, and exercise, which will be limited right now. Adjusting to the psychological and social demands, including the difficult lifestyle adjustments, and engaging in effective interactions with his healthcare providers. His ADLs can't be performed independently, and with his declining vision, wound, and surgery, he's going to need assistance with hygiene, bathing, grooming, and dressing. Also, he's anuric, but he has continent bowels and will need assistance with commode or bathroom until he has greater healing and weight bearing, as mobility is going to continue to be decreased. There's going to be accommodations needed for position changes, transfers, and eventually ambulation. He will need the appropriate durable medical equipment to accommodate his ADL safely and with as much independence as possible. His ability to perform any IADLs has been very compromised. He can't manage or administer medications, prepare meals, shop for necessities, drive, manage his personal finances, or see well enough to even use a telephone. He lives with his wife and 5 children who are his main caregivers for all his ADLs and IADLs. And obviously caregiver burden will increase after surgery for the family due to his decreased mobility and increased education needs for all the family who have to assist him with his cares, especially as this continuing decline. The clinical judgment for discharge will be based upon Mr. Jose's condition at post-acute care needs, the desires of the patient and family, and approval from Medicare for discharge home with home health or to a less acute facility. This would be a multidisciplinary approach, and the team would make recommendations as well. The final goal will be to assist the patient to regain functioning at an optimal level as possible and to return home safely with the family. He's going to need physical therapy, occupational therapy, durable medical equipment, and he's going to need nursing in the home for dressing changes, education, blood glucose monitoring, and especially the non-compliant patient, his caregivers are going to especially need a lot of education regarding his disease management and lifestyle changes and to prevent further complications. Follow-up scheduling is going to be needed, and any home modifications also need to be made due to his physical limitations at discharge. And a stay in the rehab may be useful, and especially if the family are supportive and benefits allow, which Medicare usually does. Priority nurse case management strategies at the patient level and system level. At the patient level, it's going to be clinical and educational strategies. The system level is going to be managed care strategies. The use of clinical and educational interventions will be used for Mr. Jose in the acute and post-care setting. The nurse case manager should advocate and coordinate and communicate and set up necessary services, provide education to achieve the desired outcomes, and nurses will provide assistance with ADLs and assess, document, and monitor his physiologic stability. Promoting wound healing with proper wound care and prevention of any infection is going to be needed. A wound care nurse will also be consulted and needed to assess the wound and provide recommendations prior to surgery and for post-op care. While in the hospital, sliding scale insulin will be given according to protocols. Lab tests should be considered in this plan, and any delays that should arise should be addressed so they can prevent further complications, and we need to be aware of increasing patient satisfaction. And prior to discharge is going to need a safe transition from any IV medications to oral medications. And educational interventions are going to be the best way to prevent further decline and complications. His health literacy is low, and so he's going to need translation services or a bilingual nurse case manager to communicate. And if some of the family doesn't, even though some of the family does speak English, there should be a medical translation for the patient. A diabetes specialist and nutritionist should be consulted to provide the teaching as well. And medication teaching should include administration and the side effects and the symptoms to be reported during and after the hospital stay. Interventions at the system level regarding managed care will be used to encourage the wise use of limited and costly health care resources. While in the hospital, the nurse case manager should do a thorough system assessment, documentation, and placement into utilization management language so that he can get the insurance authorization and reimbursement needed. The authorization of the hospital stay may include wound and surgical interventions needing to be reported for approval and maximum reimbursement and to prevent denials. Understanding the benefits of Medicare is essential for the nurse case manager. Well, in the hospital, the case manager should monitor also patient flow to make sure he's receiving the adequate level of care before and after surgery and with any changes that may occur. Prior to discharge, assessment of needed durable medical equipment, and it should also require the input and ordering from approval of from Medicare. And goals should also include strategies to prevent readmissions, especially ER visits that have happened in the past, and navigate the complexity of the healthcare system and decrease future costly complications. He may need rehabilitation services and home health services, but the family should be aware that Medicare doesn't pay for 24-hour care, meals, homemaker services, or personal care, but they will be the main care providers. And they need to transportation to the next facility, and for the family is going to be needing to be addressed. A key strategy also is partnerships that will empower Mr. Jose in the self-management after discharge. Primary care and specialty care follow-up is going to be important. And also Medicare Part B covers outpatient diabetes self-management training to cope and manage diabetes. And they also cover eye exams, foot exams, glaucoma tests, therapeutic shoes and inserts, and nutritional therapy services. Healthcare utilization by Mr. Jose has been influenced by multiple forces, and health promotion and disease prevention strategies weren't utilized most of his life. And they were critical earlier after diagnosis, but they weren't utilized effectively. A lot of these are due to economic, language barriers, cultural factors, and educational level, which has resulted in underutilization. And he needs high quality primary care, and many of the benefits of primary care and for his complex illness were not utilized previously, but he lives in an area where they are available and but weren't utilized. Now his condition is deteriorating. Mr. Jose has had repeated access to acute care systems now and multiple inpatient stays, emergency room visits, which hopefully through outpatient care we can decrease these multiple hospitalizations and improve outcomes. After surgery, the greatest need is going to be supportive care using post-acute care and home environment and a rehab environment and in the community. These services are needed to prevent future complications and decline. According to Healthy People 2020, there should be interventions that use community health workers to help patients manage diabetes and serve as a bridge between underserved and vulnerable populations and the healthcare system, including primary and specialty care providers. And they have a unique understanding of those they're serving, and they can provide the education, coaching, and social service support to improve diabetes testing, patient monitoring, medication adherence, diet, physical activity, and weight management. The hospital provides the hospital with proper staffing and training for evidence-based management of hyperglycemia and hypoglycemia, and having the proper systems in place to prevent errors and promote patient safety. Nurses should be trained in the proper dosing documentation for all high-risk medications such as insulin, according to hospital policies and protocols. Risk management is a reactive model, identifies potential risk areas, but often are called in after an undesirable event occurs. Prevention of adverse events can be avoided through quality improvement and risk mitigation programs by the hospital to be proactive in identifying potential risks. These include, but are not limited to, pressure ulcer prevention, fall prevention, infection control, DVT prophylaxis, and high-risk medication protocols, proper staffing and training. Other safety issues include quality of care access, transitions in care, environmental safety issues, communication, confidentiality. Nurse case management will have been successful if the surgery took place with no delays or complications, and the wound is healing with no infection. Nursing assessments and documentation of care is completed, and the patient is satisfied with his care. Communication and coordination among all team members occurred, and nurses assisted with ADLs, and there was no falls or injuries occurred. Labs will have improved towards a blood glucose within a normal range, and hypoglycemia would have been prevented, and there would be no signs of infections. Medications are given on time per protocols, and side effects monitored. Educational interventions will have been successful, and if materials are provided, will have been provided at the appropriate level of health literacy, translated into Spanish, and medication and disease management were understood by the patient and family, and referrals were made and followed through. And at the systems level, managed care interventions would have been successful. If Medicare authorizations and reimbursements were completed, transitions were made to the next level of care, and he received the supplies and equipment needed with no denials. Rehab and home health services are in place with the family as this primary caregiver at the home, and they're taking full benefit of the physical therapy, occupational therapy, and social services offered in that setting. And he's also receiving adequate follow-up and prevention through eye exams, foot exams, and glaucoma testing and nutritional services. And he is there's been no readmissions or ER visits, and they've prevented, and there's no further decline or complications. In the hospital setting, and in any setting, all the staff are trained for evidence-based protocols and care according to the setting they're working in. And these are my references, and thank you for listening to my presentation.